Hey guys, this is Dr. Hub. Now we'll look at the diseases. This is of the international significance. So this includes, we'll look at the TDR. So what is TDR? TDR is nothing but the tropical diseases, and they are the strategy by the WHO. So what does this include? This includes, there's a Chagas disease, then there is also the dengue, Ebola, then comes the helminthiasis, there's leishmaniasis, then comes leprosy, there's also the lymphatic filariasis, and there is also malaria, there's onchocerciasis, there is the schistosomiasis, then there is a trypanosomiasis. Next, there is also presence of TB, that is the tuberculosis. Next, we'll move on to the international surveillance diseases. So, international surveillance diseases. So, this in short is the ISD, and we are looking as per the WHO. So, this includes, there is the avian influenza, then there is also the cholera, there is the MERS, CoV and SARS. Then comes the presence of Ebola and the Hendra virus. Then comes the influenza, the leptospirosis, as well as the meningitis. Next, it includes the Nipah virus infection and the Rift Valley fever. So this is all the international surveillance diseases. So the Nipah virus and the Rift Valley fever. Then there is also the plague. Then smallpox. There is tularemia. Next is the hemorrhagic fevers. There is hemorrhagic fevers, and this includes the Lassa as well as the Marburg. Then under the international surveillance diseases, there is also presence of the yellow fever. Then comes the Zika virus. Then there is also the louse-borne typhus. Then there is malaria as well as the salmonellosis. Next, there is also the relapsing fever and the paralytic polio. Now, let's look at the IHR. So, IHR stands for the International Health Regulation, and this is of the notifiable diseases. So, this includes the smallpox. Next is poliomyelitis. This is due to the wild type of the poliovirus. Then there is also the human influenza, and this is by a new subtype. There is a new subtype. Then we will look at the SARS. Then we are going to look at the SARS. So SARS is nothing but it's a severe acute respiratory syndrome. And next, it also includes the cholera, the pneumonic plague, the yellow fever. That also includes the viral hemorrhagic fever and the West Nile fever. Now we will look at the diseases warranting isolation and quarantine. So diseases warranting the isolation and the quarantine. So what does this include? So this includes, there is cholera, there is diphtheria, there's infectious TB, that's tuberculosis. They can include the plague as well, then the smallpox, Next, there is also the yellow fever, which can be present. Then the viral hemorrhagic fevers. Then there is also presence of SARS and the flu that can cause a pandemic. So all this are under the disease warranting isolation and quarantine.